Today we'll be discussing renal function testing and other urinary diagnostic tests. And these are some of the most common laboratory tools used to assess how well the kidneys are working. We've already learned some of those that were done through the comprehensive metabolic panel. So throughout this lecture, we're going to focus on tests that evaluate renal blood flow, glomerular filtration, and tubular function. You'll get to see how these values not only help diagnose disease, but also monitor progression and treatment response. Keep in mind that while these tests are highly informative, no single result is perfect, so interpretation is always going to require clinical context. When we talk about renal function testing, we we're referring to laboratory methods that provide insight into kidney performance. This is especially true for glomerular filtration rate, or GFR, and tubular function. These tests usually require analysis of both plasma or serum samples, as well as urine samples. It's important to remember that many factors other than intrinsic kidney damage can influence these results: hydration status, medications, even protein intake through our diet. So we'll interpret these results alongside patient history. The term renal disease simply means there are histological or structural lesions within the kidney tissue itself. However, this doesn't necessarily tell us how well the kidneys are functioning. You could have histologic damage present on biopsy, but still maintain near normal kidney function early on. Conversely, function may decline before visible pathology develops. So, renal disease describes structure, while renal function testing evaluates performance. Renal failure, on the other hand, means that at least 75% of the nephron population is no longer functional. That's a major threshold where the kidneys cannot maintain homeostasis. Interestingly, this doesn't always mean that there are visible histologic lesions. You could have functional failure due to other systemic causes, pre-renal hypoperfusion, for instance, and that can occur without direct parenchymal destruction. So failure describes the loss of function, not necessarily tissue pathology. Here we see an overview of the key renal function tests we'll be covering in this lecture today. These include some that we've already learned, like blood urea nitrogen, serum creatinine, and then some new ones like creatinine clearance and albumin creatinine ratio. Albumin creatinine ratio can help us detect protein loss, and also we can look at some tubular function testing like fractional excretion of sodium. Understanding all these tests and how they fit together will allow you to differentiate between pre-renal, intrinsic, and post-renal causes of kidney dysfunction. Going back one slide, the concept of clearance is central to renal physiology. Clearance refers to the volume of plasma from which a substance is completely removed by the kidneys in 1 minute. The best known application of this is glomerular filtration rate, or GFR. This reflects how efficiently the glomeruli are filtering the blood and is considered the most important single indicator of kidney function. Every time we interpret creatinine or BUN, we're indirectly estimating this clearance process. When we come back, we're going to dive into glomerular filtration rate, how we measure it, and how we interpret those results.